Fantastic.
How are you? Is everything okay?
Fine, thank you.
Good, thank you.
There are 4 key stages in lung cancer screening: a phone screening appointment with a member of the team, a nurse appointment at one of our hospital or clinic sites, a lung scan if needed, and then you will receive your results.
Hello?
Hi, am I speaking with?
The lady asked me on the phone about my health, about smoking, and about my breathing.
If needed, the team member will book you an appointment to see the nurse. You can choose to have your appointments at one of our 3 clinics. Some people won't need more tests. If the results of the screening questions show you are at lower risk of lung cancer, then you won't need to do anything else from here. We may invite you for lung cancer screening again in 2 years to check if anything has changed. There are reasonable adjustments we can offer to help you attend your appointment. This could include things like a longer appointment or a pre-visit. At the clinic, you'll meet a receptionist who will take your name, phone number, and address. You can then take a seat and wait for the nurse to call your name.
Would you like to come in? Follow me. My name is Nao. I'm one of the nurses for the lung cancer screening. I'm going to ask you a few questions today. Check your blood pressure, your height and weight, and then we'll see if you need to have a CT scan today, okay? We'd like you to have the CT scan of your chest today, and you're going to move over to the main UCLH tower to have that done. This information sheet talks about how you're going to receive the results. If we don't see anything in the scan, if the result is normal, you'll receive the results by letter, okay? If we see anything in the scan, we will call you to let you know, all right? At the back of the sheet is our phone number and our email address. So if you've got any questions, or if you're waiting for the results longer than about 6 weeks, please let us know.
Okay.
If you smoke, we will offer you support to quit. This is optional.
And this is a map to get to the CT scan. We are here in the Mortimer Market at the moment.
There's a short walk from the Mortimer Market Clinic to University College Hospital for the scan.
Go inside, take the lift to the lower ground floor. And that's the imaging department, okay?
My name's Adrian, I'm your radiographer for today. I'm going to do your CT scan. So I'm going to explain everything to you. We're going to get you to lie down with your head at the top there, your feet at the bottom. You're going to go in and out of the machine 3 times, and it's going to ask you to take a breath in and hold, okay? And then put your arms up in the air like that. Okay, just starting there.
Breathe in. Hold your breath.
You have to breathe, hold your breath in for 3 times, and it takes a couple of minutes and doesn't hurt.
You can eat, drink, and drive as normal afterwards. Different sites may have different processes. Some may ask you to wear a hospital gown for the scan, and sometimes we can scan you with your normal clothes on. Try not to wear any clothing with metal wiring or zips across the chest, as it can interfere with our pictures. If you are wearing a bra with underwire, we'll also ask you to remove this, and you can wear your normal clothes or a hospital gown. After the scan, you will receive your results in 4 to 6 weeks in a letter to your home.
Jasmine, I've got this letter of my results. I need help, someone to read it for me.
Yeah, should we have a look? So the letter is saying that the scan has not shown any evidence of lung cancer. So that's brilliant news, isn't it?
That's very good
Really
news.
good news. So they are going to invite you for another appointment within the next 2 years to recheck your lung health. Okay? And then they've said that if you do have any other symptoms, you can go to the doctors.
A clear result is the most common outcome, but some people might need another scan in a few months because we've seen something on the scan picture that we want to check. This is to make sure it's not something serious. Other people might need to have more tests, or we might ask them to see their GP. You will always receive a letter in the post with your results.
It's important to take part in lung cancer screening because not all the symptoms are noticeable at first. So please don't ignore your letter. And if you've got any concerns at all, give us a call and we'll help to explain, and we're happy to help.
If you're aged 55 to 74 and smoke or used to smoke, it's important you come for your lung cancer screening, as you may be at higher risk of lung cancer.
Lung screening is very important. To go to the appointment, to check to see if you've got cancer. It saves people's lives. I know it's very frightening and people get very anxious, and you could take a friend with you or a key worker, but don't be frightened. It's nothing to be scared of.
Screening is important because it helps us to find cancer earlier, often before you notice anything is wrong, and when treatment is more likely to be successful.